What's up, beautiful people? Another day, another study. Currently, 14 modifiable risk factors are estimated to cause nearly half of the cases of Alzheimer's disease. And we know that previous research shows things like increased step count, increased physical activity are associated with lower rates of dementia and slower cognitive decline. A lot of times, studies will use self-reported exercise or physical activity. However, newer studies will use wearables, so pedometers or other types of wearables, Aura, Whoop, those types of things to track people's physical activity. This study did just that. It was a longitudinal study, so they followed them for up to 14 years. The average was just under 10 years, and they used pedometer-measured physical activity. They also did neuroimaging and annual cognitive assessments. So what they found was higher physical activity was associated with slower amyloid-related decline. So people who had large amounts of amyloid on testing on a certain scale called PACC5. And then overall, they had slower decline on that scale as well, independent of amyloid levels. On another cognitive test called CDR, there was a lower association for a cognitive decline in the amyloid positive patients, but not in overall. On neuroimaging, when they looked at tau is a protein that is associated with worsening cognitive decline, and higher physical activity was associated with slower accumulation of tau. And in the mediation analysis, this accounted for most of the findings in the PACC5 scale, and then about 40% of the findings in the CDR scale. And when they did a dose response analysis, even low levels of physical activity, so going from less than 3,000 steps a day to 3,000 to 5,000 steps per day, were associated with significant changes. And there was a plateau effect at around 7.5K steps per day, which in general, we recommend about 8,000 steps per day. Most of the literature is showing that I've read a plateau effect around there, where you're getting the most bang for your buck around 7,500 to 8,000 steps per day for risk reduction. And so going from inactive, less than 3,000 steps a day, to that 3K to 5K or that 4K to 7.5K range was associated with between a 34 to 54% lower rates of cognitive decline. And overall, this is adding to the body of literature showing how important physical activity is for cognitive health. Now, the thing is, the earlier you start, the better, in my opinion, because there's a large lag time in between when the neuropathological changes start to happen and symptoms develop on cognitive testing or in your everyday life. So physical activity, great for brain health. That's the too long, don't read takeaway.